Welcome to Lesson 7. Now we're going to talk about fraud, abuse, and compliance as it relates to medical billing. You've probably heard about the Health Insurance Portability and Accountability Act, abbreviated as HIPAA. HIPAA has had a huge impact on billing and coding. This law was passed back in 1996 and it was phased in over several years. But what HIPAA did, and I've brought up 5 primary points that affect billing, is first it defined the electronic standards for healthcare transactions. This is for transmitting claims and verifying insurance, electronic remittance advice, those kinds of things. It mandated the adoption of the ICD-10 diagnosis codes. It mandated the requirement for provider identification numbers, NPI numbers, and also UPINs for insurance companies. It established fines and prison terms for fraud and abuse. And it established standards for protecting the privacy and security of patient health information. Sometimes you see that as PHI, protected health information. Now dig a little deeper into HIPAA. The privacy and security standards, they establish requirements for protecting patient health information in 3 different categories. The privacy rule, it defines the requirements for protecting and disclosing PHI, and this applies to both what's called covered entities, the provider themselves, and their business associates or contractors. The security rule, it complements the privacy rule, and it established standards for the administrative, the physical, and the technical requirements for protected health information. And then there's the electronic data standards that I mentioned earlier that establish the formats and the code sets for the electronic transmission of health information. You might see that abbreviated as ANSI X12. Some good practices in protecting patient health information are anytime you communicate verbally, make sure conversations are private and cannot be overheard. They should only be with those that are authorized to know. When communicating electronically, all the systems should have the appropriate physical, administrative, and technical safeguards to protect the integrity and the availability of electronic health information. Anytime a fax machine is used, it's really recommended that a disclaimer statement be on the cover page, and really avoid using fax machines if at all possible. But sometimes that's necessary for urgent situations requiring authorization for treatment and things like that. Printers and fax machines, anything used for accessing or printing out health information, you want to make sure those are in secure areas, only available with those that have a need to know. And you want to make sure that patient information is not disclosed or released unless that has been authorized by the patient. Working remotely, this is more and more frequently an issue and more common. Healthcare providers, any of their staff and their business associates or their contractors, they can remotely access health information. This includes mobile devices, which are most frequently used. The appropriate physical, administrative, and technical safeguards have to be in place in order to protect the confidentiality and the privacy of the health information anytime it's accessed on a mobile device or in the cloud. Business associates or anyone doing business with the provider must have agreements in place before accessing protected health information remotely. Fraud and abuse. Fraud is defined by the federal government as anyone who knowingly or willingly executes or attempts to execute a scheme to defraud any healthcare benefit program. A fraud is the intentional deception or misrepresentation of the services or procedures performed by a provider in order to increase their payment. Fraud is punishable by criminal conviction, and it's also usually accompanied by fines. Abuse is not usually considered as serious as fraud because it typically is out of ignorance or lack of awareness of billing guidelines or proper coding guidelines. But abuse can result in adjustments to payments. It can result in audits and, in worst cases, suspension from an insurance payer's program. Some examples of fraud and abuse: Well, fraud would be altering medical records to justify charges, billing for services that were not performed or provided, changing dates of service, deliberately billing for the same services twice, or billing to insurance payers for the same service, any bribes or kickbacks, forgiving deductibles and copays, upcoding. We talk about that a lot in the coding chapter in our fundamentals course. Unbundled charges, use of another patient's insurance information, omitting relevant information from a claim such as secondary insurance. Abuse, and good examples of abuse would be excessive charges, unnecessary tests and unnecessary referrals and follow-up visits, billing Medicare patients at a higher rate than other patients, requiring patients to waive their rights to Medicare coverage and requiring the patient to pay for services that are covered by Medicare, failing to refund any excessive charges, and requiring patient payments for services that had not been previously billed. The consequences for fraud: HIPAA set fines at $20,000 per claim for any false claims, plus triple the damages. It set imprisonment for up to 10 years for fraud, $100,000 fine, and 10 years max for any Medicare and Medicaid kickback schemes. And there was another law introduced after HIPAA. It was called HITECH, the Health Information Technology for Economic Clinical Health Act, which is quite a mouthful. But it added to HIPAA some of the privacy and protection rights. It strengthened and enhanced those. It requires business associates to comply with HIPAA. Those are the people that support and do business with a provider. It requires notification when there's any unauthorized access or disclosure of health information. It increased civil penalties for HIPAA up to $50,000 per violation, and it set a maximum penalty for violations at $1.5 million. So fraud and abuse can be prosecuted under a variety of federal and also state laws. So that concludes Lesson 7, Fraud and Abuse and Compliance Issues that Impact Medical Billing.